Warm welcome to one and all for the 19th monthly online guest lecture organized by the research scholars at the School of Sanskrit, Philosophy and Indic Studies at Goa University. Our guest and speaker for today is Dr. Michael van Manen, and the lecture is titled The Unsettled Ground of Phenomenological Inquiry. A few announcements before the talk. The meeting, along with the chat box contents, is being recorded. The participants are requested to keep their microphones on mute throughout the lecture, which will go on for about 60 minutes, following which there will be a Q&A and discussion session. May I now request Sia to please deliver the welcome address.
Thank you, Aruvi. I'm utterly pleased to welcome Dr. Michael van Manen. Michael van Manen, MD, PhD, FRCPC, Endowed Chair in Health Ethics, is the director of John Dosseter Health Ethics Center and an associate professor in the Department of Pediatrics at the University of Alberta. Dr. Van Manen also has a clinical practice as a physician in neonatal perinatal medicine with Stollery Children's Hospital. His research is primarily concerned with relational ethics, situated within the tradition of phenomenology. Dr. Van Manen is considered an international expert in qualitative health research. He has made presentations at professional conferences around the world. His research projects relate to ethical decision making, the experiential life of the fetus, newborn, the use of medical technologies in clinical encounters, and patient family experiences of hospital care. Dr. Van Manen has authored articles, book chapters, and books in the fields of phenomenological research methodology, health ethics, neonatal perinatal medicine, and pedagogy, and has developed and taught numerous workshops and courses on phenomenological research. He is the author of The Birth of Ethics, Phenomenological Reflections on Life's Beginnings, Phenomenology of Newborn, Life from the Womb to the World, and Classic Writings for a Phenomenology of Practice with Max Van Manen. It's an honor to have you here today. I also take this opportunity to welcome Dr. Koshi Tarakan, Dean of the School of Sanskrit, Philosophy and Indic Studies at Goa University, Dr. Sanjotpai Vernikar, Vice Dean, all other faculty members, students, research scholars, and participants from and outside Goa University. I welcome you all. Thank you. Over to you, Aravi.
Thank you, Sia. May I now invite Dr. Manen to please deliver the lecture. Over to you, Dr. Manen.
Perfect. Thank you so much. I'd just like to begin by thanking the students and the faculty of Goa University for the opportunity to speak to you today on phenomenological inquiry. I'm joining you today from Edmonton, Alberta, Canada at the University of Alberta. Google tells me that we're quite far from one another, about 12,302 kilometers to be exact. Yet I'm hoping that we don't have to experience this distance in geographic terms. I can imagine that our universities are quite different from one another, as is the land surrounding our homes. Alberta, the province where I live in Canada, is without doubt a beautiful place, composed of plains, lakes, mountains, and open skies. Climate change, however, is affecting the land, and we're seeing increased forest fires, floods, and other extreme weather events. This is on top of the already extreme weather that we enjoy here. Our temperature ranges from less than minus 30 degrees Celsius to greater than 30 degrees Celsius, depending on the time of year. And yet, this is an absolutely beautiful place to live and to raise a family. Although we may be very far from one another, although our land may differ, my sense is that we can share a common dialogue. We share a common ground. We can recount or otherwise think of experiences that are meaningful to us. Experiences that we may name or try to explicate in language. Experiences of affection, love, contact. and also those experiences of worry, concern, and loss. As mentioned, my work has centered on those experiences occurring often at the beginning of life. Becoming a mother, a father, decision-making, and in the context of an intensive care unit, medical diagnoses, technological mediation, and so forth. As a physician who takes care of children from their life's beginnings, it's important to have insights and understandings into what their lives and the lives of their parents are like. We can understand such experiences as the ground for wondering, phenomenological reflection that in and of itself expresses an ethics. And by ethics here, I mean a wondering of what the life of another may be like, recognizing that there's often more to the nature of an experience than what may be conveyed in words. And we also have to have a constant awareness of our tendency to reduce another's experience to our own subjective wondering gaze. So this, I would say, is both the ground and the work of phenomenological inquiry. Experience. And if experience can be understood as the meaningfulness of disclosure, as the original site of meaning, for those engaging in this phenomenological work, we may understand writing phenomenologically as a drawing ever nearer to the phenomena in its originary and conceptual meaning dimensions, such that writerly sense-making expresses an orientation to meaning revealing. It's not within a phenomenologist to create meaning so much as to reveal a phenomena, experience in its phenomena, from a disposition of wonder. And yet we can ask, what is the nature of this ground, this experiential ground? If we take the notion of experience seriously, our directly experiencing of the world, if we can take it fully in its ambiguity, we are in wonder. Where does one experience begin and another end? What can we say of meaning that comes not only from the surface, not only comes to the surface in the present, but also in a future present, the eventuality of experience? This is one of my favorite quotes by the Dutch phenomenologist J.H. van den Berg, which expresses this orientation to the ground of phenomenological inquiry. A phenomenologist is so fascinated with life, the world as it reveals itself to their wondering gaze, that they are forever attentive to the varieties and subtleties of human experience in all of its complexities and concrete details. For me, this is the project of phenomenology. Recognizing this term does not name a unified tradition. There are as many different phenomenologists as there are phenomenologies. So now I want to let you in on a little secret. I'm not a philosopher in the technical sense, and certainly not not someone who works from an armchair. This is where I work, right? A newborn intensive care unit at the University of Alberta. My practice consists of taking care of children born premature, those who've had complications during their delivery, and those born with various congenital anomalies that may or may not be amenable to surgery or medical interventions. Phenomenology offers much to the practice of this place when realized as a phenomenology of practice. As I previously mentioned, healthcare providers need insights into the life experiences of patients and the families for whom they serve. Such inquiry, a phenomenology of practice, is oriented to life meaning that may inform the caring practices of healthcare providers, whether they're physicians, nurses, social workers, or other healthcare professionals. And of course, a phenomenology of practice has import outside of healthcare spheres. Now, in newborn intensive care, most children do very well. However, some do not survive. Their deaths may stay with their parents who lived through their short lives. For this presentation, I would like to show the unsettled ground of this form of phenomenological inquiry, this phenomenology of practice, by way of example. And so I'd like to begin with an anecdote. This anecdote that I'm going to read recounts the words of a parent whose child died following a decision to discontinue mechanical ventilation. He passed away peacefully, held and loved by his family. The context is the newborn intensive care unit, the NICU. His mother recounts leaving her son just after his death, walking away. There's one thing that I regret, and that's when I was leaving. I just took one more glance into the room, and it's a very weird being and seeing situation, where for the past 3 weeks, your son is in a room, and he's got these tubes, he's got these monitors, he's got everything and everyone that's looking after him. There's always somebody in the room watching him. And then when you leave, he's the only one in the room. There's no monitors on. He's sleeping in his bed, and that's all you see. And that's one memory that I wish I didn't have to experience. It's really painful to think back to. I ask you to pause and think on these words. What meaning do they show? What experience is it of which they speak? What is the phenomenon here? I would like to say that one possible phenomenon, an interpretation that we can make, is that these words speak of a lasting, last impression. A memory that this parent will live in the years that follows. Now, some may say a memory is simply a lasting impression, the physiology of which corresponds to the organization of cortical neurons as a consequence of sustained activation. A memory can be understood to consist of the residue, the remains, the remnants of a past that we recall in our present. And being in our past, we should be able to disregard our memories, over and done, as bygone events. But this, of course, is not true. We live our memories, our past in the present. As William James writes, there are some events that have so deeply impressed on us, it is as if they have scarred our very cerebrum. So let us ask, can we speak of a lasting impression as a phenomena, as a fully fledged, distinguishable experience? What causes a particular impression to be left? Why one moment compared to another? Can we suppress or alter such memories? At what point are they pathological? As we wonder about these questions, we may recognize a tendency to think about a lasting impression in a causal manner. After all, in our day-to-day lives, we're constantly encountering people, places, and things that may or may not be constitutive of memories. Some days pass by that seemingly leave us untouched. Perhaps such days are empty or relatively routine. Nothing particularly interesting happened. But there are those moments, however brief they may be, that have pressed hard on us. Some of these are joyful moments, the birth of a child, humorous moments, the delivery of just the right joke, traumatic moments, being subjected to violence, prideful moments, a celebrated accomplishment, and we could go on. These impressions, of course, all vary in their texture, intensity, and vividness. Some moments we may like to revisit in our imagination. We think of them fondly as we pass asleep. Yet other moments may be intrusive, coming at us, disturbing our routines, work, or even our passing thoughts. Let us ask, what is the lived meaning of a lasting impression? What are the experiential beginnings and endings of such impressions? How do we understand the meaning of memories as lasting impressions? Is an impression the same as a memory, or are impressions less firm, less definite, more unsure, vague, unclear, more easily mistaken, or remembered wrongly, or stuck with emotional confusions? When do we call a moment impressive? What can leave a lasting impression? What kind of remembrance is impressional? The concern here is not simply with their physiology nor their psychology. Instead, we ask these questions from a wondering about their phenomenality, the lived meanings that have impressed on us so deeply that we forever live with them. Not all impressions are lasting. Some are vague, equivocal, or poorly formed. Perhaps this is typical of all impressions. Those impressions we can only think about as they elude our attempts to recall them in their impressiveness. But instead, let us consider ourselves with the meaningfulness of those singular moments that press upon us with the imprints of lasting impressions. They visit us again and again and again. We may have very specific emotions around them: regret, despair, joy, happiness, fear, anger, or love. Or they may be somewhat undefined in their surreality. And we may also acknowledge that some impressions have a dormancy, whereby their meaning is only later revealed. The latency of such impressions is their meaning, a meaning that is not merely significant because it lasts, but also because it grows in depth. So now let us consider each and every word and passing phrase in this anecdote. Let us consider it as unsettled ground. Words that are unsettled because they cannot settle. It's not just that the words are expressive of too much meaning, the meaning itself is not settled. There's one thing that I regret, and that's when I was leaving, I just took one more glance into the room. This anecdote opens with an important series of phrases that deserve our attention. We may consider their meaning based both on what was said and what was left unspoken, but nonetheless makes it possible to say these words. There's one thing that I regret. A lasting impression may show itself, among other things, to be felt in its recollection as meaningful. And that's when I was leaving. A lasting impression has its own particular moment, its own particular time. I just took one more glance into the room. The phenomena is disclosed in a moment for the last time. Now, these preliminary reflections reveal a truth. If the mother had not stayed with her child for a meaningful period, a time of many glances, coalescing to looks, gazes, and contemplations, then she could not or would not have taken one more glance for the last time. Yet, enigmatically, it is the glance that produces the impression, a glance that she could not help but take. It seems to be a contradiction that what is formative of a last impression, one more glance, may be so transitory in its occurrence. After all, the literature on memory formation tells us that we are more assured to remember, to commit to so-called episodic memory, if the provocation is especially intense, remarkably unusual, or of a longer duration. What is more fleeting than a glance? It's the briefest of looks. Barely a second, or it would have been more than a glance. It would have been something else. No, we know the story of Orpheus leading Eurydice from the underworld, and his fateful glance. We may wonder, would a careful or meditative look have produced something else? We may reflect on the usual nature of our engagement in the world, which elapses into memory. We pass through life, completing various activities, perform a particular task to achieve an end. We normally cannot remember all of our series of looks that compose a day, just as we cannot necessarily recount in their vividness all of our day-to-day interactions with family, friends, or colleagues. As Edward Casey writes, certain human activities are essentially remainderless. They merely take place and exhaust themselves in their occurrence without leaving any significant residue. They do not precipitate themselves into our subsequent life in any lasting way. Impressions tend to be short, pressing, and momentary pushes. From a stamp, imprint, or other pressing means, the residue are marks and markings. And yet, the enigmatic thing about a lasting impression is, despite its possible ephemeral nature, it may fail to fade with the passing of time. It stays with us after it takes place. It stands out as that one thing from the stream of our consciousness, as something primal that has affected us, leaving us changed by its residue. And so we may have regrets, remorse, or unresolved emotions tied to such events. Remember, the word impression is from the Old French impression, as a pressing on the mind, and from Latin impressionem, a pressing into, onset, attack. There is a force to an impression, a literal pressing into. To be pressed upon is to be touched, even if we're touched purely through the contact of our eyes, a glance. The impression has power, to be sure, a force that leaves us changed. And so we may begin by reflecting on the phenomenality of a lasting impression, as it far exceeding its duration. With a glance, a parent may see what cannot be unseen. Its brevity determines its significance. Perception has pressed on to this mother. How could she not have looked back to take one more look at her child? And it's a very weird being and seeing situation. Sometimes we may wonder about the words that people use to describe their experiences. Are their words quite right? Are weird being and scene situation illuminative of meaning? Do these phrases aptly point to the eidetic meaning of a lasting impression? How do these loculations relate to the experience as it was lived through in the moment of its occurrence, the past, compared to as it is recalled in its eventuality, the present, or some distant future? The answers to such questions are elusive, evasive, and yet from these words, a very weird being and scene situation, we may consider the experiential autonomy of such lasting impressions. As its own moment, a particular being and scene situation, we may recognize that at times we find ourselves in a lasting impression, as it comes from our unreflective consciousness to reflective awareness. This is not to say a lasting impression is dissociated from the flow of time. Rather, we may recognize that those most pointed of lasting impressions are conspicuous. Like an impressionist painting, the images of a form reflecting the world as it was lived in that moment. But unlike a picture that we may look at as an object, we find ourselves in the being of this situation. While we may not recall what happened directly before or after such a moment, as if the temporal borders of the memory are unclear, the memory itself has its own resolution as an impression. And so we may consider the vestiges of a lasting impression. William James writes, "The stream of thought flows on, but most of its segments fall into the bottomless abyss of oblivion. Of some, no memory survives the instant of their passage. Of others, it is confined to a few moments, hours, or days. Others, again, leave vestiges which are indestructible, and by means of which they may be recalled as long as life endures. Consider how we may speak commonly about first impressions, those almost instant conclusions we draw when we first meet someone or experience something for the first time as a first impression. And we know that first impressions matter. First impressions express value. Was it a good impression, a bad impression? The lay literature is full of advice on the do's and don'ts of making first impressions. Make eye contact, avoid interrupting, be authentic, and so forth. We create such impressions after all. We should acknowledge that a first, like a last impression, can be lasting. And the contrary, not all such impressions are memorable, as they fail to survive the passage of time. While there can only be one first and one last impression, there is a singularity to the last impression that transcends the first. And here is the insight. A first impression is evanescent in the wake of a last impression. If we make a poor first impression, we can make amends, we can apologize, or otherwise improve on it. The last impression, however, has finality. It's the last one. It is the impression, if it lasts, that we are left with as a forever impression. In this way, the last lasting impression may stand out from the stream of consciousness of our memory in its exceptionality. There is an extraordinariness to the moment, even if it occurs in an everyday moment of ordinariness. And in the moment of a lasting impression, we may be both in the moment, yet also see that moment as we lived through it. The lasting last impression lacks a true antonym. Where for the past 3 weeks, your son is in a room, and he's got all these tubes, he's got these monitors, he's got everything and everyone that's looking after him. There's always somebody in the room watching him. These few sentences express the experiential concreteness of these memories. A lasting impression is not conceptual. It's not an idea, a schema, or an abstraction. We cannot memorize impressions. We cannot simply be told of an event and experience it as a lasting impression, as if it is our own. While psychologically we may wonder at what depths of our psyche such impressions are formed, phenomenologically we know it is through our direct experience of the world that our perceptions become impressions. And yet to experience an impression, we may wonder if one needs to be impressionable. Now, what could be more impressionable than the parent of a child who's required care in the NICU? These parents have lived through the exaltations of new beginnings, a new life being born, only to be faced with the medical reality of prematurity, congenital anomalies, or some other clinical complications necessitating intensive care. The tubes, the monitors, everything and everyone. Even the hardest of souls softens under the wear of such experiences. And in the techno-medical context of an NICU, abundant with medical technologies and medical staff, parents hopefully come to know that this place, as a place, is where their child is looked after, cared for, and cared about. Care is in and of itself meaningful, and to reflect on the meaningfulness of care as a topic really deserves sustained attention. Ethics permeates the stories of each and every child receiving medical care, even the so-called uncomplicated cases, manifesting something originary that touches us. In moments of care, closeness, intimacy, and responsibility, we may hear the words of Cicero. The life of the dead is placed in the memory of the living. This is significant for the meaningfulness of a lost impression. This memory is not conceived from the death of a child, but instead from their having lived. Following a lasting impression is more than a simple apprehension or other understanding known to be factually true. It is not just that the parent recalls a memory of their child as an occurrence. Rather, in the lasting impression, they recall their perception as it was conceived in their lived experience of their child living in the NICU. I'm not saying this quite right, but we need to say it like that for now. And then when you leave, he's the only one in the room. There's no monitors on. He's sleeping in his bed, and that's all you see. While we may be tempted to consider the mother as leaving her son's body after his death, the mother does not mention his bodily remains. Instead, she leaves him as the only one in the room, still sleeping in his bed, as if he was still alive. We may even wonder whether phenomenologically her son is really dead, in the sense of just a dead body, in a moment such as this. And therefore, whether she'll always be burdened with the impression that she left him in that lonely room, a room now tainted with this last and lasting impression. As readers, we may hear the reverberations, "That's all you see," of such a lasting impression that will endure in the memories of a parent. And yet we should also acknowledge that the mother's words, while expressing truth, do not speak it. The truth is that the mother sees so much more than she speaks or says. She sees so much more than the physicality of her child lying there, in his bed without monitors on, alone in the room. Phenomenologically, what she truly sees is her child vulnerable, and perhaps in that very moment, disregarded, neglected, or abandoned, even in his death. This is a tentative yet necessary wondering. It's a reflection that we must have. By "that's all you see," we can recognize that her child is all she sees, meaning her child is everything. From 3 weeks of hospitalization, the lasting impression eclipses and assuages what came before it, all of the care he received. It is not that the moment wholly negates the time and care that he received in the NICU. It is not an experiential erasure of the past and the present, but it may unsettle a parent's previous perceptions, haunting their consciousness. And if such perturbations lead the parent to question the care that their child received from them or the hospital staff, we can appreciate just how profoundly upsetting such a last impression may be. In this way, the moment of a lasting impression implicates all of us. We recognize our activity or passivity as moral inaction or action. In such moments, it is in the fullest normative sense that our actions are valued as right or wrong, good or bad. By definition, impressive experiences do not leave us untouched. And that's one memory that I wish I didn't have to experience. It's really painful to think back to. If we accept that we live our memories, it would be a mistake to pass over the lastingness of a lost impression. Said differently, we would be misguided to reduce the significance of a lasting lost impression to some form of finality of time. It's quite the opposite. The lasting impression transcends time in its persisting presence in our lives. In On Time and Being, Heidegger writes on presence and lasting. To presence means to last, but we are all too quickly content to conceive lasting as mere duration, and to conceive duration in terms of the customary representation of time as a span of time from one now to a subsequent now. To talk presencing, however, requires that we perceive bidding and abiding in lasting as lasting in present being. Abiding and abiding in lasting as lasting in present being. What is present concerns us, the present that is. What lasting comes toward us as human beings. What lasts has a lasting presence, and perhaps will never leave us. And what is more, what lasts comes into presence in its present being, meaning in those moments of remembrance. Following, we may understand that while we may recognize the significance of a lasting impression in its moments of its perception, other meaning may only come to our awareness later in life. Just consider those moments that have seemed of little significance in our childhood or youth that in our later life are realized in their significance. The phenomenological insight here is that there are some moments of our lives that we never quite finish living through. These memories do not dwell solely in the past, but instead lived in the present as we relive them, to continue to live through them in our present lives. So we can speak to a good or a bad impression. Are painful impressions bad and comforting impressions good? Is morality dichotomous when it comes to our lasting impressions? Perhaps because of their lasting, their inability to exhaust themselves, their incompleteness, we need to acknowledge that through the flow of time, normative aspects of experience may be revisited and reinterpreted. In other words, it's possible that what was painful in the past becomes a source of comfort in the future, or that those memories that haunt us are also memories that we will treasure. Still, we should also appreciate that there are aspects to lasting impressions that are fixed, set, or otherwise have permanence. For our memories, we cannot simply change, distort, or otherwise try and imagine another narrative. If we try to imagine an alternative past, for example, instead of walking away, we imagine holding our child one more time. Or perhaps our fateful glance instead revealed a nurse walking into the room to stand by our child, or some other happening. We realize that our past memory cannot be revised, substituted, or otherwise unfolded into that which we can more comfortably recall. In this way, too, our last impression is lasting. Some years ago, I read a paper on closing ethics. It left a lasting impression on me, even though I can't really recall the title, the author, or even the journal it was published. As I recall, the authors pointed out that the field of health ethics has largely focused on matters of which we could term opening ethics, such as obtaining informed consent, building rapport, or other issues related to autonomy, shared decision-making, and so forth. In comparison, the term closing ethics points to how we bring our relationships with others to a close, or otherwise how we conclude our involvement in their care. This project, this anecdote, and writing up some reflections, stirred in me an increased awareness that how we leave a clinical encounter, whether that be a research interview or some other meeting, it in of itself expresses an ethics, the texture of which can be expressed in a phrase, some related to, yet also differing from, a lasting impression. If we were to reread that opening anecdote again, as healthcare professionals, intuitively we can recognize that this moment would be painful to remember. Something different should have been done in the final moments of care that this family received. We should have attended to our closing ethics. Parents, after all, live with these final moments, moments that transcend the passage of time, that perhaps are never truly in the past at all. As Herman Broch wrote, "No one's death comes to pass without making some impression, and those close to the deceased inherit part of the liberated soul and become richer in their humanness." So what does this all mean for healthcare providers or other professionals engaged in phenomenological work or engaged in clinical practice or otherwise the caring professions? Moments are meaningful. Not only do we need to recognize our closing ethics, but we need to attend to the possible meaning of end-of-life experiences for parents. We need to recognize parents live with the loss of their child well beyond their time in hospital. That brings me up to about 45 minutes, and I wanted to make sure I wasn't cutting into the discussion period, so I'm going to stop there. Thank you.
Thank you so much, Dr. Manen. May I now call upon Aditi to please moderate the Q&A session. Aditi?
Hello.
Hi, Aditi.
Hi.
You may please
Yeah.
go on with the
My
Q&A session.
Yeah. So the floor is now open for Q&A. If you have questions, you can raise your hands or put up your questions in the chat box.
Yeah, Professor Manen, I mean, thank you for a very evocative presentation. It was really wonderful listening to you. In fact, it touched a chord in my heart, because I sometimes think of the last impression that I have of my father, whom passed away when I was not near him. I was a bit away, but I recall our conversations, last phone call, last meeting, etc. So I was just wondering, as a coping mechanism, I appreciate all your phenomenological grounding, which you have done through the last impression. But to confess, my own strategy to cope with this kind of, situation is sometimes blurring the distinction between memory and imagination. So as you rightly pointed out, when you quoted Heidegger, that we sometimes revive some of these expressions as if certain things happen. So there are imaginary conversations sometimes happening. So I just wanted to know, as far as ethics is concerned, since you also is much concerned about ethics, the closing ethics. The closing ethics, should it always be grounded in the lasting impression that we actually had, or could it be brought in some other way, as I was pointing, through some form of imagination? If so, would it be really ethical? That's my question. Yeah.
Thank you very much for the question. My sense is that healthcare providers or other professionals dealing with children or patients or families or other individuals, they need to have insights into what experiences might be like for those for whom they care. It's very hard to ever come up with some kind of dogmatic advice and say you should always conduct yourself in this particular way, because every situation is a bit different and has nuances to it. What is so challenging about ethics in the moment is that sometimes we say the right thing in the moment, but a year later, we realize maybe something different should have been said. Or maybe what was said was what someone needed to hear in the moment, but later on, what they heard can become a source of discomfort. So we're constantly dealing with this tension of what's right in the present, but what's also right in some future present, right? Recognizing, like you said, that, those moments that we live with, that, we come back to and we say, gosh, what if I had done this? Or, I should have done that, or I'm going to just imagine it this way, right? Because you're right. Even our memories of events change over time. And sometimes it's like we create memories that never happened, right? I wouldn't get so much into the psychology of it, because I'm not a psychologist to say, how do you support people's coping, right? There's all kinds of theories on dealing with grief and bereavement and so forth. But I do think as healthcare professionals or teachers or anyone else who works in a profession, we need to be thoughtful of, all right, how are my actions going to stay with this family, not just 5 minutes from now, but also as they live beyond their time in the NICU. This anecdote that I shared with you came from a larger research project, a narrative research project. And the idea was that for many of us who work in intensive care, we don't see our families after their child has passed away. Meaning, we see them a day later, but we don't see them 6 months later or a year later. And we're not always aware that many of our families actually do struggle after they leave the NICU. So we have a responsibility to understand not only bereavement in the context of the NICU, but bereavement as it unfolds through these families' lives. So I pulled this anecdote out from that larger study as an example of trying to show kind of this ground of phenomenological inquiry, and just how much that we can think or wonder or reflect on from a single anecdote, right? I'm not sure what your experience is, but I read a lot of qualitative research. I'm an editor for the journal Qualitative Health Research. And often I'll read a paper that's composed of, 30 short little anecdotes, or quotes from participants. And the authors, they write literally 1 or 2 sentences after every anecdote. And so much more could be opened up, right? So I'm also kind of presenting this anecdote in this way methodologically as an example to show, when we talk about meaning and experience, there's so much there, right? So much that we can begin to unpack. And I think part of our job as researchers or clinicians is to help open up experiences, not to explain them away, but rather to help people see what otherwise could be passed over and not seen. Sorry if I'm answering this in a roundabout way, but I really appreciate your question.
No, it was a very informative kind of response. Thank you.
I think part of it also relates to this notion of ethics. It's funny, I'm the director of an ethics center. I have a chair in health ethics, and I still struggle wondering exactly what ethics are, right? Because in healthcare, back in the days when I was being trained as a medical student, ethics were described as something very easy, right? Respect the autonomy of the patient, beneficence, non-maleficence, justice, right? These 4 principles, right? As long as you're doing them, you're doing a good job, right? But ethics is so much more than that, right? Ethics is really that discipline that deals with these questions that we can't answer with a simple do this or do that, right? We can't reduce them to some kind of simple logic. At least most, I think, frameworks or understandings of ethics, you realize at some point you reach a point where logic only gets you so far, right? So ethics grasps or tries to grasp with these situations of otherness and morality and so forth. But it's a fascinating discipline. I hope one day to get further in it. I'm working on it.
Thank you. Thank you.
Yes, Srijita, you can unmute your mic and ask the question.
For this moving presentation. Uh, I can see a lot of emotional responsibility in the way you have presented, you have approached this particular text. Thank you very much for that. Um, and I would be interested in knowing more about the methodology that you have been talking about right now, but a little bit more how you kind of place this particular work in the phenomenological research methodology.
Sure. So, as mentioned in the introduction, I co-wrote a book with Max van Manen. Hopefully, it's pretty obvious. My father is Max van Manen. So, how I approach phenomenology is directly, you could say, it's stemming from his work. And I'm indebted to him, not only as my father, but also I'm indebted to him with regards to how I think and look about phenomenology. Right. Now, if you wanted me to talk about phenomenology as a method with respect to phenomenology of practice, that's challenging. That's a talk in and of itself, right? How does one begin to work with text, right? I think for my father's work, methodologically, you could say how he understands the focus of phenomenological inquiry is it's a reflective study of the manner in which we directly experience the world, right? And by a reflective study, I mean phenomenology offers value simply from raising questions, right? Not necessarily always from making declarative statements, but simply raising questions up, raising our wondering and our understanding, hopefully generating some insights. That's the value of phenomenology. And ultimately, for phenomenology of practice, we're interested in everyday and extraordinary life events that present themselves in the context of our being in the world, right? As a physician, I've never had a child born premature. I'm a parent. I have 2 healthy kids. One's 10, one's 15. They're getting older. But I've never had a kid born premature. Neither of my kids has ever required medical care. As parents, we've not been faced with life and death situations for them. Yet I need to have insight into what that might be like. I'll never be able to say what it's going to be like for all parents, but I need to have some kind of understanding. And that shapes how conversations occur, shared decision making occurs, how I act, how I know how to act, right? In those particular moments. So I'm hoping that kind of points it to that. For me, methodologically, phenomenology is a philosophically grounded form of inquiry oriented to directly how we experience the world, but it's also a questioning form of inquiry. Now, there are many, many different schools of phenomenological inquiry, so I think it's challenging to speak about all in the same sentence. There are many different philosophers who understand phenomenology in different ways, assign different kind of technical meaning to terms like consciousness compared to lived experience, compared to intentionality. I'd be happy to do a talk focusing on one of those specifically, but or if there's a specific aspect you want to focus on. But if you're looking for how does one engage in this kind of work, I would point you towards my father's work, right? Because that's how I've approached this.
Okay, thank you so much for that response. I was basically looking for that journey that you have taken up when you arrived at this particular text. Yeah.
Sorry, what journey I took? Is that right?
Yeah, like selecting this particular anecdote, there will be a journey that you might have gone through. So I was curious about that.
Yeah. No, it's for this particular anecdote. So like I mentioned, it came from a larger narrative study. And for me, narrative inquiry is a different project than phenomenology. Right? In narrative inquiry, the aim is representing the stories of people's lives and recognizing that stories often reflect individual sense making, right? So people make sense of their experiences through stories, right? And we hear that when someone, tells you the story of their child's passing or their father's passing, right? That's how you tell that story reflects your sense making. So it seemed like a very nice approach to begin to explore bereavement in the context of the NICU. But where I found narrative lacking is that depth, right? That attending to a particular phenomena, right? Because multiple phenomena often compose stories, right? So it's funny in the paper that we produced from the study, which is a narrative inquiry paper. This anecdote appears, and then there's a short paragraph after, which makes some basic narrative kind of reflections. And I have to say, when I was proofreading the paper, I was like, oh, there's so much more here. And it just bothered me to no end that, something more needed to be lifted up, if that makes sense. And honestly, I mean, that's where I'm sure we could write, 20 papers from that one paper, taking, an anecdote out, right? Because, often there's much experiential material that you can work with from other methodologies, right, or other projects. So I hope that helps.
Okay, thank you.
Anyone else?
I mean, just if you permit, just to latch on to what you have said now. I mean, this is again, there are some of our research scholars here for their benefit. Just to recount, so a narrative approach, as you said, sometimes lack that depth, and a phenomenological inquiry can perhaps open it up so that that depth is more visible, and that's one of the methodological engagements I hope you are making also in your approach. So I mean, that's something which as researchers, we phenomenologically inclined researchers, we may have to take care of how to open up the phenomena further, so as to reveal its depth, where narrativity perhaps is not able to reveal it in its entirety. So that's perhaps
it's sometimes challenging, right? Because when you begin talking about narrative inquiry or phenomenological inquiry or interpretive phenomenological analysis, IPA, or I was watching one of the videos from a previous presentation in this series on microphenomenology, right? Just as part of preparation to get a sense of how this would be like, right? There's a certain understanding of, what does IPA look like? What does microphenomenology look like? What does narrative inquiry look like? And, there is value in kind of not losing what is narrative inquiry or what is phenomenological inquiry. Right? You don't want to lose it by somehow blurring everything into some homogeneous or superficial, qualitative inquiry. But on the other hand, I think there are opportunities for blurring the margins, right? So what would a narrative phenomenological study look like? Or a phenomenological narrative study look like? What would a phenomenological ethnographic study look like, right? If you start to blur things together, what kind of methodological commitments do you have to attend to when you're taking two different methodologies and bringing them together? So by no means am I advocating for, this is how it has to look for phenomenology compared to narrative inquiry. I think there's opportunities to bring things together. I've read examples of narrative inquiry where the researchers write with such phenomenological sensitivity. I think, I almost wonder, should you call this a phenomenological study, right? So on the one hand, I really like when things become blurred and shifted into one another. But on the other hand, I also sometimes struggle when I'm faced with these very generic qualitative research studies that are general thematic analyses that lack depth, right? Because, for one reason or another, the researchers or the students haven't maybe spent as much time exploring the methodological possibilities that different traditions within qualitative inquiry may offer.
Thank you. That clarifies much.
If that's all the questions, then over to you, Arabi.
Thank you, Dr. Manen. Thank you, Aditi. May I now request Diksha to please propose a vote of thanks for the lecture.
Thank you, Arvi. A very good evening to all of you. On behalf of the School of Sanskrit Philosophy and Indic Studies, Goa University, I'm here to express our heartfelt gratitude to all those who have contributed to the success of this webinar. First and foremost, I'd like to express my deepest gratitude to our esteemed speaker, Dr. Michael van Manen. Your insightful and thought-provoking address has left an indelible mark on our minds. Your expertise in the field of phenomenology has enriched our understanding and inspired us to pursue new avenues of research and knowledge. We are truly honored to have had the opportunity to learn from your extensive knowledge and experience. Thank you so much, sir. I'd also like to extend a heartfelt thanks to Professor Koshi Tarkan, the Dean of our school. Your constant guidance and unwavering support have been instrumental in the success of this event. I'd also like to extend our gratitude to all the faculty members of the school. Your continuous support has been an instrumental in shaping the minds of our students. A special word of thanks goes to all the research scholars and students at SSPIS. Your active participation and enthusiasm have made this event a vibrant and intellectually stimulating gathering. Furthermore, I would like to express our appreciation to all the participants who joined us today, both from within our institution and from outside. Your presence have enriched the discourse and created a truly inclusive atmosphere. Last but not the least, I'd like to extend a heartfelt thanks to all those who have helped with the promotion of this webinar. Your efforts in spreading the word, reaching out to participants, and creating awareness about this webinar have been instrumental in making it a success. In conclusion, I'd like to once again express our deepest appreciation to Dr. Michael van Manen, Professor Koshi, all the faculty members, research scholars, and students, the participants from within and outside our institution, as well as all those who helped with event promotion.
Thank you all for being a part of this wonderful gathering. May we continue to learn, grow, and make a positive impact on society together. Thank you and have a pleasant evening. Over to you, Arvi.
Special thanks, Professor Manen. It was really insightful presentation. Thank you.
Thank you again, Professor, and thank you again for having me. It's been an honor. Have a wonderful evening.
So I'll just conclude. Thank you, Diksha. And we are now come to the close of the lecture. Participants may note that the recording of the event will be posted on our school's YouTube channel, Philosophy at Goa University. And we'll be back next month with another online guest lecture. Thank you.